With respect to protecting your skin and preventing skin cancer and the signs of photoaging, the two most important things that you can do are protect yourself from the sun and then don't smoke. With respect to sun protection, we want you to wear a sunscreen that's an SPF 30 or above, that's broad spectrum, every day to your sun exposed areas. So that's even cloudy days in the winter. In addition, you want to protect yourself with a wide-brimmed hat and clothing as much as possible. And then try to avoid the midday hours, so from 10 a.m. to 4 p.m. or when the sun's rays are their most intense. So try to do your outdoor activities either earlier or later in the day. Prevention of skin cancer and prevention of photoaging start with avoiding ultraviolet radiation, both from the sun and especially tanning beds. Anytime your skin is changing colors from sun exposure or from tanning bed exposure, that's bad. That's damaged skin. Many dermatologists refer to a tan as a precancerous glow. Of specific concern is the increased use of tanning beds over the past 2 to 3 decades. This is contributing to the skyrocketing incidence of skin cancer in the United States. New studies are showing up to a 3 times increased risk of the most deadly form of skin cancer, which is melanoma, and its association with tanning bed use. So at all costs, never use tanning beds and really try to protect yourself from the sun as much as possible.
On a daily basis, skin cancer screening is a large part of my practice. I visit with patients daily to discuss the dangers of ultraviolet light. We're exposed to this every day, and unfortunately, tanning beds are such a popular choice at this time. It's so upsetting to see teenagers come in and they're still going to tanning beds. They come in very tan and they go on a regular basis. Or I may have a patient say, I just go a couple times a year. It doesn't really matter how much a patient goes. One time is too many. We have learned, and there are studies that have connected and linked the significant increased risk of skin cancer, melanoma, large increase among young patients, very dangerous, very deadly, and it is highly associated with tanning beds. My primary goal when I see patients is to educate them about tanning and to discourage and allow them to understand how dangerous they are. Sunscreen education is part of my everyday practice. Picking a sunscreen may not be that simple. I find that products over the counter are extremely overwhelming. Patients are overwhelmed. They don't know what to look for. The marketing is heavy, and they're very driven by that marketing that they see on a constant basis. Patients come in and they bring their products in. Unfortunately, a lot of their products, they're spending a lot of money on them and they don't have proven ingredients to help protect and repair their skin. So my job is to educate them on picking the proper sunscreen and how to look for it. I review the ingredients. Also, if they're spending money on skin rejuvenating products, I educate the patient also on how to pick those proper ingredients, and I guide them on choosing those products to give their skin the best result and protection for safety and for benefit of beautifying the skin.